So here we are dealing with a classical case of non-union. Patient underwent L4 to S1 fusion, and in the L4-5 bone is growing in both in the anterior part, but as well in the posterior part here. The facets are growing. Previously, patient had a L3-4 fusion, and those hardware are removed, as well as patient has 2-3 anterolisthesis. In the area of the surgery that we did last, in the 5S1, we see that the left S1 screw is loosening, that's the halo around that. The right side, on the proximal part, there's a little loosening, but not too bad. It seems that the cage is adequately positioned, and in the 4-5 everything is growing in the front, but not in the 5S1. In the 5S1, there is still a hypointensity that separate the two bone, as well as in the facet there is as well hypointensity, whereas in the 4-5 the bone is growing together. Here as well we see that there is a vacuum effect. If bone grows together, no more scar will be produced, and there is no vacuum effect in the 4-5, but there is one in the 5S1 that indicates that there is a non-union there. Now, if you look at the foramen, there is some bone growth that when the bone macromotion causes more scarring, build more bone, and there is foraminal stenosis that correspond to foot numbness here, and as well in the other side here. Previous fusion is solid. 2-3 listhesis seems to be asymptomatic. Patient has no symptoms in the anterior thigh. So most of the symptoms now correspond to the non-union in the 5 and S1.